If you or someone you love takes magnesium supplements, please don't skip this video. Magnesium is one of the most popular supplements in the world. Millions of seniors take it daily for sleep, muscle cramps, and heart health. And yes, when used correctly, it can be genuinely helpful. But here's what most people don't know. Taken the wrong way, at the wrong time, or by the wrong person, magnesium can silently cause serious harm. Today, I'm going to share the 4 risks that most doctors forget to mention. Stay with me, because one of these could directly apply to you or someone sitting right beside you. Let's get straight into it, because your time matters. Magnesium is the 4th most abundant mineral in your body. It's involved in over 600 enzymatic reactions, from regulating your heartbeat to keeping your muscles from cramping at 3 in the morning. The NIH confirms that it plays a role in blood pressure control, blood sugar regulation, bone strength, and even brain function. So yes, you need it. But here's the problem, and this is especially true if you're over 60. As we age, 2 things happen at the same time. Our gut absorbs less magnesium from food, and our kidneys become less efficient at flushing out excess magnesium. That means older adults walk a very narrow line between deficiency and overload. Add supplements into that picture without guidance, and you're walking it blindfolded. A 2025 review published in the journal Nutrients, which analyzed 48 separate studies, confirmed that magnesium deficiency quietly builds over years, often with no obvious symptoms until something serious happens. Early signs like fatigue, loss of appetite, and mild weakness are easy to dismiss as just getting older. Meanwhile, a July 2025 study from the UK's NHS Trust found that seniors with low magnesium levels were 2.35 times more likely to suffer acute cognitive decline, things like sudden confusion, disorientation, and what many families mistake for early dementia. This is a staggering and underreported finding. So we have a real problem here. Seniors often need more magnesium, but taking supplements carelessly can cause a completely different set of dangers. That's exactly what we're going to unpack together right now. These are the 4 silent risks every senior needs to know, and I promise, by the end of this video, you'll know exactly what to watch for, what questions to ask your doctor, and how to use magnesium the right way if you need it. Let's go through them one by one. Here's risk number 1, and it's the one that shocks most people. Your kidneys are the gatekeeper for magnesium in your body. When you're young and healthy, they do a remarkable job, automatically flushing out any excess magnesium through your urine. But as you age, kidney function gradually declines. This is completely normal. In fact, by age 70, most people have kidney function running at 50 to 65% of what it was at 30. Here's where it gets dangerous. If your kidneys can't filter efficiently, magnesium from supplements starts to accumulate in your blood. This is called hypermagnesemia, too much magnesium. And in seniors with reduced kidney function, it can happen silently, without obvious symptoms at first. According to Stat Pearls, published by the NIH, magnesium toxicity's early signs include low blood pressure, muscle weakness, fatigue, and nausea, symptoms that are incredibly easy to attribute to other causes in an older adult. If allowed to progress, it can lead to respiratory paralysis and, in severe cases, cardiac arrest. WebMD's medical review team and the Council for Responsible Nutrition both emphasize, if you have any history of kidney disease, chronic kidney issues, or if you're on dialysis, you must speak with your doctor before taking any magnesium supplement. Period. No exceptions. The solution: get a basic kidney function test, called a creatinine clearance, or eGFR, before starting any supplement. This is a simple blood test that can tell you how well your kidneys are working. Transition. Now, here's risk number 2, and this one involves something that almost every senior takes alongside their magnesium. Risk number 2 is about drug interactions, and this is where things get genuinely complicated for seniors who are already managing multiple prescriptions. Let's go through the most important ones. First, if you take proton pump inhibitors, that's drugs like omeprazole, pantoprazole, or Prilosec, for acid reflux or heartburn, here's something critical. Long-term use of PPIs is scientifically documented to reduce magnesium absorption significantly. Multiple case studies, including one published in the American Journal of Kidney Diseases, showed patients on long-term PPI therapy developing severe magnesium deficiency. Ironically, Many seniors take magnesium to fix symptoms they don't realize are caused by their heartburn medication. Second, diuretics or water pills, commonly prescribed for high blood pressure and heart failure. Drugs like hydrochlorothiazide can increase the amount of magnesium lost through urine, worsening deficiency. Mayo Clinic's press team specifically flagged this. Third, if you take antibiotics in the aminoglycoside class, like gentamicin, magnesium can amplify muscle-related side effects. Fourth, certain heart medications, especially those affecting calcium channels and heart rhythm, can interact with high-dose magnesium in ways that alter your cardiac output. This is especially critical for anyone on medications for atrial fibrillation. The solution: before starting magnesium, bring every medication bottle to your next doctor or pharmacist visit and ask specifically, does magnesium interact with any of these? This single step could prevent a serious medical event. Transition: we've covered your kidneys. We've covered drug interactions. Risk 3 is something I call the timing trap, and it's so easy to fall into. Risk number 3 is one of the most overlooked because most people walk into a pharmacy, grab the first magnesium bottle they see, and assume all magnesium supplements are basically the same. They are absolutely not. There are over 8 common forms of magnesium sold as supplements, and they behave very differently in your body, especially as you age. Magnesium oxide is the cheapest and most common form you'll find on shelves, but it has the lowest absorption rate, only about 4%. It draws water into your intestines, which is why it's often used as a laxative. For seniors, this form frequently causes diarrhea, cramping, and dehydration, which are already elevated risks in older adults. Magnesium glycinate is widely considered the most gentle and best absorbed form for older adults. A 2025 clinical study cited in the Alzheimer's Drug Discovery Foundation found that seniors over 65 who received magnesium glycinate for 12 weeks showed a significant 9.1% improvement in cognitive assessments, while those under 65 saw no such effect. That's a remarkable finding specifically for our age group. Magnesium citrate has moderate absorption and is often used for constipation relief. Magnesium L-threonate is newer and marketed for brain health. Magnesium malate is often preferred for muscle function and energy. The danger here? Taking a high-dose magnesium oxide supplement while already experiencing digestive issues, or taking multiple forms simultaneously, is a recipe for electrolyte imbalance and dangerous dehydration in seniors. The solution: discuss with your doctor which form is right for your specific health goals. Don't let price be the deciding factor. Transition: and now we arrive at risk 4. This might be the most surprising one of all, because it involves what you take magnesium with. Risk number 4 is about something called mineral competition, and it's a concept most supplement labels won't tell you about. Magnesium and calcium are deeply connected. They work together in your muscles, your heart, and your bones. When you suddenly flood your body with high-dose magnesium, especially without adjusting your calcium intake, it can actually displace calcium from where it's needed, including your bones. For seniors already at risk for osteoporosis, this matters enormously. The balance between calcium and magnesium is a ratio that researchers have been studying seriously. Some studies specifically found that a very high calcium to magnesium ratio in the diet was linked to cognitive problems, while correcting that ratio with appropriate magnesium glycinate supplementation improved brain scores. But this goes both ways. Too much magnesium can also suppress calcium levels in the blood, a condition called hypocalcemia, which can trigger muscle cramps, the very symptom many seniors are trying to fix with magnesium. Additionally, magnesium interacts with potassium and vitamin D. If your vitamin D levels are low, magnesium supplementation becomes less effective. And if you're low in potassium, common in seniors on diuretics, magnesium deficiency can actually cause potassium deficiency as well, creating a cascade of electrolyte imbalances. The solution: don't supplement magnesium in isolation. Ask your doctor to check your calcium, potassium, vitamin D, and magnesium levels together as a panel. A full mineral picture is always safer than guessing. So let's bring this all together, because I don't want you walking away from this video scared of magnesium. That's not the goal. The goal is for you to be informed, so you can use it wisely. YW checkmark how to take magnesium safely as a senior. The 6-point checklist: get tested first. Ask your doctor for a serum magnesium test and a kidney function panel, eGFR or creatinine clearance, before starting any supplement. Choose the right form. Magnesium glycinate is generally the best tolerated and best absorbed form for older adults. Avoid high-dose magnesium oxide as your primary supplement. Start low and go slow. The NIH's recommended dietary allowance for adults over 51 is 420 mg per day for men and 320 milligrams per day for women, from all sources, including food. Supplement doses above 350 milligrams per day should only be taken under medical supervision. Review your medications. Bring your full medication list to your pharmacist and ask specifically about magnesium interactions, especially if you take PPIs, diuretics, antibiotics, or heart medications. Don't supplement in isolation. Have your calcium, potassium, and vitamin D levels checked at the same time. Treating one mineral deficiency while ignoring the others creates new problems. Watch for warning signs. If you experience unusual fatigue, persistent diarrhea, muscle weakness, low blood pressure, or confusion after starting magnesium, contact your doctor immediately. Magnesium is genuinely important, especially for seniors. A 2025 large-scale review in Nutrients confirmed that chronic magnesium deficiency is tied to shorter lifespan, higher rates of chronic disease, and faster cognitive decline. The seniors, Enrica, one study published in the Journal of the American Medical Directors Association showed that higher magnesium intake is directly associated with a lower risk of frailty in people over 60. You need this mineral, but you need it on your terms, with proper testing, the right form, the right dose, and awareness of how it interacts with your specific health picture. If you found this video helpful, please give it a thumbs up. It genuinely helps this information reach more people who need it. Share it with a family member or a friend who takes supplements. And hit subscribe if you want science-backed, senior-focused health content every week. Drop a comment below and let me know. Have you ever had a reaction to magnesium supplements? Or has your doctor ever talked to you about these risks? I read every comment. Stay informed, stay safe, and I'll see you in the next video.